Okay. All right. Welcome everybody to tonight's talk about how to support your children or child to get back to school. My name is Dr. Liz Corcoran. I am a psychiatrist by background, but I am also trained in functional medicine, which is root cause medicine, nutrition, lifestyle medicine. So I've quite a broad background that I bring to the talk tonight. And I am happy to be joined by Dr. Ellie Hambly, who is a clinical psychologist. And we are going to share this talk, and I'm going to be covering a little bit about the anxiety, how it presents, how it can be detected in your child, and then handing over to Dr. Ellie, who's going to talk a little bit about how to be a detective with your child and how to maybe implement some of the skills that we use in clinical practice in your parenting, and how to kind of unpick maybe some of your child's behaviors and understand maybe could this be anxiety? And then when anxiety crops up, which it is going to do in all of us, how you can maybe add to your skill set, how you can toolkit to navigate those situations and come out the other side having learned from them, and help your child build up the resilience, really. We're focused in particular on this transition back to school because both of us have been really aware that there's a lot of anxiety in families and kids about the fact that there's been such a huge break, plus summer holidays, and on top of that, it's a strange time. So what is your child going to think of this? What do you think of it? It's like unprecedented time. So that's why I really wanted to put on this talk, because wanted to help you guys. And we can't meet with everybody individually, but we want to be able to give you something that you can think about, work on. And included with this will be the handout with some of the exercises we're going to talk about, and the link to the video so you can watch this talk again. So this is a sort of bones of what we're going to talk about this evening. And if we're going to take questions at the end, but just feel free as they crop up to throw them in the chat box, and we'll make sure that we try to cover them. And if at any point, you need to step off, as I said, you'll get a copy of the talk, link to the talk later. So what is anxiety? I think it's something a topic which we all talk about. We use the word anxiety, but it can come in lots of different forms. So we talk about fear, worry, dread. Sometimes we don't even have words for it, and it can take a while to sometimes attribute the way we're feeling to anxiety. It can sometimes be something which can be felt in our body alone. When you think about anxiety, it's actually considered a normal human emotion. And when we're both talking about anxiety today, we want you to not think that the things we're talking about are considered a clinical diagnosis. We're not talking about generalized anxiety disorder or phobic disorder. We're just talking about, the gamut of being a human and encountering new and novel experiences that bring this emotion out. What it basically is an inbuilt wiring that has been there since the beginning of humanity, that's there to protect us from, whatever we might be experiencing that's novel or different, that might be perceived as a threat. So it brings about a whole body readiness to respond to a threatening situation. And we'll talk in a minute about how do we label what's a threatening situation and what isn't. But it's important to maybe understand that this is, old wiring. It's an animal part of the brain, and it has with it all of the readiness that we needed back from those caveman days. So it can often be predominantly felt in the body. So adrenaline is released from your body. It's a hormone that travels around, and it readies you to react to the threat. So you might find your heart rate starts going up, your blood pressure goes up, your breathing starts to be fast and shallow. And as the muscles are ready to either get you out of there, the flight, or to fight, you might feel tingling and muscle tension. and conversely, because when you're facing a threat, you don't need to be digesting your food. You suddenly might feel your stomach drop or tummy ache. You might need to suddenly go to the toilet. And I mean, it's a common situation. I'm sure you can think of. I'm, immediately thrown back to university exam days. So, clammy hands, that kind of thing. So, often people can experience anxiety, as I mentioned, solely in the body. They might not be really aware this is what's going on. It comes with time that you're able to describe and use the language parts of your brain to actually put words to your feelings, and also to understand the build of that feeling as it's coming up, as you think about your threat, as you're in what you label a threatening situation. So that when we're talking all the time about our kids and even ourselves, sometimes there can be a lack of awareness of what we're going through is anxiety. I mean, even myself, I didn't attribute a tight feeling in my chest that I used to get with certain particular scenarios, that actually this was an anxiety provoking scenario. And I know it sounds really obvious that I should have known that, but sometimes our brain protects us from really realizing how worried we are, but our body will give it away. And so it's important to kind of understand that the language is really going to come with age, development, and sometimes whether or not you can, allow yourself to be fully aware of your worry about a particular situation. So I've used the sort of analogy of the past, right? When we were our caveman days, what were the threats that we used to encounter back then? And, hearing the sound, thinking I've got to suddenly protect my tribe, my circle from the threat, which would be like for life and limb, right? This saber-toothed tiger is coming to invade our camp. We need to be ready to fight it. Now you've still got that wiring in our brain, but what are the things that trigger the same response in us now? And I'm going to put it out there, that I think maybe some of these things, and that annoying stock image that we have seen everywhere, these are the new threats. These are the new things which find us suddenly starting to feel stressed, suddenly starting to feel that tight chest, that, what am I going to do? My family is threatened. My safety is threatened. So, for each one of us, it's going to be different. So I want you to go away from this and think a little bit about what are the threats signals that you have in your family and that you allow into your own home, that what you are exposed to on a daily basis and that your child's exposed to on a daily basis, and in what ways might you moderate their exposure to those things to help to reduce the overall burden of anxiety signals and triggers going on in your house. So I'm talked about some stressful things. Maybe even those logos have got, your heart rate's going again. So I'm going to just hand over now briefly when we talk immediately about how do we get out of an anxiety provoking situation. So I'm going to invite Dr. Ellie to come over and talk to us now a little bit about how we can get out of anxiety provoking moments when we're stuck in that heightened state.
Excellent. Thank you so much, Liz. So Liz has explained what happens to the body when we get really anxious, and I'm going to give you a few techniques of how to kind of trigger or tell your brain that it's safe to come out of those that high state of anxiety. So we can't rely on the saber-toothed tiger going away. The triggers that set us off are surrounding us all the time. So we then have to skill ourselves up and our children on how to manage that and how to let our bodies know that it's safe and it's okay. And one of the most powerful ways to do that is by using our breath. It's so often overlooked because it's something that we do automatically. But as Liz was saying, when we get anxious, adrenaline goes around the body and we tend to breathe in the kind of quite shallow, so in the top part of our chest. So when we can really concentrate on breathing deeply and really focus on that, even for a minute, it can let our body know that actually it's safe. And this is something that you can do pretty much any age, any developmental stage. you might need to adapt it, make it a bit more creative, a bit more fun for younger children. And I'll give you a couple of examples of those in a minute. But I'd really like everyone, if you're happy to just join in. And I'm just going to talk you through it. It's really straightforward. I would like you to, first of all, breathe in through your nose and out through your mouth. And just keep doing that at your own pace. So breathe in and out. And keep going. And you might notice there's a little pause that happens just as you breathe in before you breathe out. And try and pay attention to that. And keep going at your own speed. There's no right or wrong speed, whatever feels comfortable for you. And just keep going for a little bit. And then ideally, as you get more practiced or your child gets more practice, you want the out breath to be a little bit longer. There's another signal that it's safe and it's okay. So keep going. I quite like to make a sound because you're really exhaling. And again, kids quite like doing that. I try and make it quite fun. And as I was saying, there are different adaptations you can make. So sometimes I talk about a balloon. So you breathe in and then you breathe out into the balloon. And what you really want is for your stomach to go, I've got confused now. So when you breathe in, you want your stomach to go out. And when you breathe out, you want your stomach to go in. But depending on the age of your child, you might not want to confuse them. Just make sure they're concentrating on breathing in and breathing out. Some of us are more visual, so some people really respond well to thinking about a square. So you breathe in for 3, out for 3, in for 3, out for 3. And then ideally you might make it into a rectangle. So in for 3, out for 4, in for 3, out for 4. And sometimes children might really like to just draw that, and that's something they can concentrate on. I think, yeah, those are kind of key ones, but you can try and make noises. You can roar like a lion when you breathe out if you really want. There's those sorts of things. So just bringing you back to what might seem the absolute basics, but it's such a powerful key, is just remembering to breathe. And yeah, you can count breathing in 1 and out for 2, and just do that for 10. So and you keep going. So some different strategies for you. And I'm hoping that everyone's feeling a little bit more relaxed now that we've done some breathing. And then if Liz, you can move us on to the next slide, I'll give you some other things to try. So this, I've gone with very creative, kind of, yeah, quite young children. You can use the same ideas for older kids and for yourself. And this is basically a muscle relaxation exercise. So first of all, it's using your hands and pretending you're squeezing lemons. So you scrunch them up really tightly. And it might be for some kids, you want to pretend you're boxing. You can, yeah, adapt it as you want. And then you relax it and you can shake it out. And that can feel quite nice. You can do it in whichever order you want, but if we go to the fly next, so imagine there's a little fly on your nose and you can't use your hands to swipe it off. We've had quite a few wasps and flies around recently with this hot weather, so you can imagine it. And then I'm all about fun and being a bit silly, but you just imagine you have to screw up your whole face and try and get that fly off. And the sillier the face, the better. And kids seem to absolutely love this. So you just, yeah, really scrunch up your face. If a kid looks quite angry or anxious, really make the most of that. And then the next one is chewing the carrot. So you're trying to, getting your jaw really scrunched up. We often feel tension in our face, which is why we're working on the nose and the jaw. So if you can really tense it, you can clench your teeth and then you relax it. And you can do all sorts of exercises to do that. And then with the swing, it's using your whole body. I've got a really creaky chair, which you might hear. So using your whole body and swinging back and forth. And that's tensing up the stomach muscles, using your legs. And so you can swing. And lots of children, particularly if they're maybe on the ASD spectrum, might, when they're anxious, rock back and forth. So it can be potentially using that, because they're using that sometimes to try and self-soothe. So that is a good one. And then hiding in your shell is getting those shoulders. Lots of us feel tension in our shoulders, so you scrunch up. Imagine you're trying to get your head down into your neck and really tense up, and then drop, and then roll those shoulders. And then stretching like a cat. It can be touching the sky. Really enjoy that stretch. And then squeezing through the fence, you're trying to get yourself as small as possible, and you kind of squeeze through. And then this is my favorite. And again, if children have sensory issues, you might need to adapt to that, but squishing your toes in the mud, so really scrunch up those feet and kind of wriggle those toes around. We often forget about our feet, but they hold us up all day long, so it's good to give them a bit of attention and really scrunch them up. And then I normally like to shake it out afterwards. And this is just an example that you can make them quite creative and quite fun. So when we feel anxious, we kind of go into ourselves, our emotional brain takes over. So instead of trying to think about things, you need to engage the body to help your child and yourself. We all feel anxious, to kind of get out of that anxious state. And once you feel more relaxed and that adrenaline has gone out of your body, which takes about 30 minutes, you can then maybe start to reflect and talk about what's happened or what's going on or what they're worried about. So yeah, it's using kind of the body and the physical symptoms. If we go on to the next slide, please, Liz. So this is another one which is using mindfulness, but it's quite an active mindfulness one. Rather than asking children to kind of sit and try and just be and kind of try and clear their minds, this is helping them focus and is a really good entry point into mindfulness. And it is essentially what it says on the tin. It's really asking your child, but again, it's something that you can do with them, to first of all focus on something you can see. So have a quick look around your room. I'm facing a very dark blue wall, so I really want to look at that. I can notice the paint strokes on the wall, and you just look at the details and take about 10 seconds just to find something and really explore what you can see. You might notice judgments that come in, and that's absolutely fine. You might notice other thoughts pop into your head. I just want you to acknowledge them and just let them float away. Okay, and then if we shift on to something that you can hear, so the next sense, it might be that you can't hear very much, which is fine, or you might really try and focus on something far away, maybe something close by in the room. It might be a buzzing that you can hear from technology. You might be able to hear some children far away, but just take a moment to really focus on what you can hear. And again, if you feel or notice any thoughts popping in, that's completely normal. Okay, and then notice something that you can smell. If there aren't any smells around, maybe focus on the air going in through your nose and the sensation that that brings. Or maybe, yeah, you can feel the air entering your nostrils. Okay, and then focus on the mouth, so what you can taste or the sensation of your tongue in your mouth. Maybe you can kind of feel your teeth, or if you've just had dinner, you can maybe focus on that. Sometimes with children, I might give them maybe a mint or something to eat just beforehand, or spray kind of lavender spritz around the room just before they come in. So really explore that, the taste. And then lastly, it's touch. So it's whether you focus on where you're sitting, the feel of your chair that's holding you, whether you're holding onto maybe the arm of a chair, or if you've got a blanket or something nearby, you can feel that, or maybe your trousers. Really explore what you can feel, and have a really kind of infant fascination in what it is that you can feel. Okay, and it can feel like a very different kind of change of pace when you go to that, and you can take as long or little as time as you can. Sometimes children find it really helpful to hold something or take something to school with them. Some people have a stone because they find that quite grounding, and that's something they can reach for and touch if they're feeling anxious at any point when they're in school, or something important to them, or a fiddle toy, so that they can really concentrate on that touch. Often people find the hearing sense or the touching sense can be the most grounding for them. And it's completely normal the first time you do that. You kind of question it. It feels very strange. You might have lots of judgments. I know that when I was doing it, I was like, am I doing this too slowly, too quickly? I noticed something on the wall that I needed to clean. That's completely normal to have those thoughts to begin with. But the more you practice it, the more experience you'll get, and the quicker you'll be able to get into that kind of calmer sense. And sometimes mindfulness doesn't necessarily help you get calmer straight away, but it helps kind of clear the fog and help you really try and focus on what's happening for you, so you can connect to your body, which can give you all sorts of information to help you going forward. So I think that is my kind of relaxation and kind of strategies done. So I'll hand back over to Liz, who can
Okay,
take you to the next steps.
thank you. So the idea is that you would get comfortable with using these tools in the midst of anxiety provoking. Your child would begin to feel comfortable using these tools in the midst of an anxiety provoking scenario. But you will need to begin to practice them when you are not stressed out. It's like trying to start cycling by joining the Tour de France. You want to actually learn how to cycle, get on the tricycle with them, and be practicing these skills in the weeks running up to school starting, so that should they get anxious that first few days at school, in the loud playground, whatever scenario for your child is the most anxiety provoking, they can snap into these toolkits, these practice skills, and that it would hopefully allow them to facilitate themselves grounding themselves, calming down. And what we know about adrenaline is it has a very short half-life, which means that your body can only use it very quickly. It begins to burn up, be broken down, and eliminated. So it's not a situation where you can keep that anxiety at a high level for a long time. And doing things like the breathing and the mindfulness exercises signal your body that you are not in a threatening situation. So it's almost a bit like a hack. You can take control and signal to your animal brain that, I am safe, I am okay, I am in school, I can see my teacher, I can see a safe place, whatever, your child is anchored on as their kind of safe places at school. So if we think a little bit about how we talk to our children, and a bit about the way we prepare them for situations, it's really thinking about how we help them to navigate the world. So a bit like what are the saber-toothed tigers of our modern age? Part of that is actually what we as parents label the world with as we go forward with our little crew, our family. I like to think about it that we are sort of captains of our ship. And when you talk to your children all the time, conscious and unconscious communications are going on with your with your little ones. You're teaching them about what is safe and what is unsafe in the world. And this has been a unique situation because obviously you guys won't have had your pandemic plan. You won't have had that on the shelf. Oh, let's pull that down. What are our family values around pandemics? What are our views on social distancing and masking? You know, we didn't have this sort of stuff prepared, and a lot of it's just kind of tumbled out of us. And I really kind of want to, invite you all to really, those of you who are co-parenting, those of you who are single parents, spend a bit of time thinking, okay, what does our family feel about this situation? How do we want to communicate to our children around what's going on? You know, there would have been some conversations, I'm sure, about coronavirus, about washing hands, things like that. But maybe think about the fact you're sending your child back to school, and in some ways they're doing some of the things that we've been telling them not to do, right? How are you going to talk to them about that? You know, like, for example, you know, in my family, we've been talking about, well, lots of very clever doctors and scientists have decided that, when they've looked at the children, they've decided that children actually don't pass it around a lot, and they're very safe, you know, and they've decided that it's really safest for kids to go back, and that there's nothing to worry about as long as everyone carries on, you know, washing their hands and doing what they've asked us to do. So, you know, that's just what we've talked about in our house. But what kind of ideas and expectations do your children have? You know, when you talk to them about going back to school, what has been the conscious messages and unconscious messages? And when I think about all that, you know, I've got two different age children. I've got a 10-year-old and a 5-year-old. Now, the way I talk to my 5-year-old is obviously going to be different. So you've got to couch it that's developmentally appropriate. So that's age, but also each child that might have special needs, learning difficulties, or other learning needs. You have to think about, what does this child need to know? What questions are they asking me? And how can I convey to them that it is safe for them to return to school, that this situation has been thought about, and that they will be looked after by responsible adults at their school that they know already in most cases, and they'll be in a setting that they're comfortable with. So think about what messages you want to convey to your children, and that's personal, as I said, to every family. So I also want to think about, you know, it can be lonely being in charge, right? It can be hard having that role of leading the family. And I want to just take a second to really acknowledge that part of our guiding our children and helping them regulate their emotions is really influenced by what we bring from our past. What do we bring from our own previous experiences of stressful and threatening situations? You know, not everyone had an ideal childhood. I don't think I've met anyone yet. I don't know about Dr. Ellie. I doubt she's met a perfect person who's had a great childhood. Everyone's got stories about stressful situations and traumatic situations that they experienced. And really think about, what did the adults in your circle, did they acknowledge your worries, or did they dismiss them? Were you kind of given a snack? Were you told to go to your room? Could they really make space for you as a little person to voice your worries and anxieties? And acknowledging the fact that, you know, that is going to influence, you know, your parenting style. It's not to say that, you know, because you didn't get the skills and tools from your childhood that you can't manage with your child. You can. And actually, you know, one of the reasons I went into psychiatry was actually helping people to realize that you can learn these things as adults. You can develop these skills as adults, and you can give more than you've been given onward to the next generation. Be really aware when you're in those situations where your child might be anxious. Check yourself, okay? Because your child, in a way, is going to be drawing on you like a gas station. They're going to be drawing on you to help regulate their anxiety. And if you feel out of control yourself, take a minute, just a second, just do the breathing exercises and tell yourself, I can do this. I have, you know, I am an adult. I am in control. And outside of the situations where you're parenting, lean on your helpers, lean on your team, lean on your adult system, um, and talk about, I'm worried about them going, like share your worries with your friends and your family, so that when you need to provide that calm, united front to your child, you're able to do so. Probably, you don't want to be sitting sort of thinking out loud in front of your child, well, God, all your fears and worries about this being a failure. Keep that behind the door. Just discuss that with your partner, discuss that with your support system, and tell your child it's safe. We're going to be watching to making sure you're safe, and we're going to be keeping a good eye on how things are going, and all the scientists in government are going to be keeping a check on how things are going. Help them to realize there's people outside of your family that are in charge of these things, and it's not all on their shoulders to be responsible for. So I just want to really encourage and acknowledge that it can be very stressful to moderate and support your child through an anxiety-provoking situation, particularly if they're neurodiverse. There's other issues at play. Lean on your support system. This is a stressful time on top of everything else. So just use the people you've got around you. So the next thing we're going to move on to is talking a little bit about some of the skills that we as mental health professionals have in our toolkit, and we're going to pass on to some of them to you. And there are ways in which when we talk and meet with children and young people, the ways in which we try to understand, why did this particular situation or scenario, why was it perceived as a threat to that child or to that adult? And to understand and unpack what was behind that. So I'm going to hand back over to Ellie, and she's going to talk a little bit about the way we do that.
Okay, thanks, Liz. So very much building on what Liz has said is that, us parents have got quite a hard job anyway, and we've been thrown into something even more tricky than normal. But what I really want to kind of focus on is that as parents you have a lot of skills, and you are all here tonight because you really care about your children and you want the best for them. And so what we really want to do is draw on those skills that you have. You know your children better than anybody else, and we're just going to give you a little bit more in kind of terms of strategies, but also hopefully reassure you that you're probably doing a lot of these things automatically. And I think as parents we don't get enough credit for all those tiny little things that you do that you probably don't realize you do. But creating time in your busy schedules to come to a talk like this, but also managing day to day in what has been some very interesting times, and keeping yourself sane and your children sane, I think is actually really impressive to start with. And the strategies that I'm going to give you now are not to put extra pressure on you, but to help you kind of guide some of those conversations potentially that are coming up. So if your children are maybe a little bit worried about going back to school because they haven't been there for so long, or they're going to a new school, or starting school for the first time, is about using maybe everyday situations that allow you to discuss things. Car journeys are fantastic, because you're both facing forwards, and particularly children can find that easier. It's less focus on them. Having the eye contact can be tricky sometimes. And also if they come to you and say, oh, I don't know about this, or Liz and I were talking about going to the supermarket, and actually if once you go in and you see all these people with face masks on, and your child says, oh, why are they all wearing face masks? Because actually when you're at home it feels completely normal, but when you're faced with all these people wearing strange things over their faces, so you can't really read their expressions, you don't know what's going on, that might be a point where those questions come out. And it's about trying to use that moment, even though you're in the back of your head thinking, I need to do this shopping, I need to get on with this, and this, to try and maybe discuss and work out what it is that they're worried about, or how it makes them feel. How does it make their body feel? And this is very much what this diagram is suggesting. So there's a situation that might be going to the supermarket and seeing lots of face masks on people, wearing gloves and all sorts, and that might trigger a worry, so a thought. That might be, they will look really scary. And you can use that and kind of say, okay, well, how does that make you feel in your body? Does that make your palms sweaty? Does it make your tight filled chest, or make your tummy feel a bit funny? And then that can help you understand what emotions are there. That might be fear, that might be anxiety, or that might be just feeling a bit weird. Sometimes it's hard to name those emotions, or it might make us feel really sad, because particularly if you've got older kids, they might notice that real difference. And then there's the behaviour, so that's what they do. They might want to just run back out of the shop, or they might want to just hold on to you because they feel very uncertain. And using these, it's called the hot cross bun method. This is a cognitive behavior therapy tool, but it's essentially just pulling apart that worry and understanding it, and being very curious about what their worry is, and trying to maybe unpick it a little bit. As adults, we can be very good at second guessing what our child might be worried about, and a lot of the time we might be right, but sometimes we really need to make sure we are right. Just double check, because you can come up with some of the strangest and most wonderful things sometimes that you do not expect at all. And we've got to be careful that we're separating our worries to our children's worries, and giving them that space to explore them. And you are giving them such valuable tools by helping them identify their emotions and their reactions and their bodily sensations. We spend so much time on teaching our children how to read and write, but not so much focus is spent on how to identify emotions and talk about relationships and difficult situations. So by really trying to encourage these conversations, you are skilling your children up for life, and you can give them these tools to navigate some tricky times now, but also in their future. And kind of echoing what Liz said, it's about working out what your narrative is as a family, and trying to make sure that you're all on the same page, so that your child feels as contained as possible, so they don't feel really uncertain in these uncertain times. And it's a tough job as a parent to try and make your child feel secure and safe as much as possible. We're not always going to manage it. There will be moments where it doesn't quite go right, and that's completely normal. We're not expecting perfection at all. We're just giving you some tools to make it as successful as possible. And actually, when things do go wrong, acknowledging them and saying, oh, I got that wrong, or I'm sorry about that, is actually really powerful in itself. And identifying those moments is really important. We call it rupture and repair in kind of psychology language. So I try and see everything as an opportunity. Even when things go wrong, it's an opportunity to learn, and you can reflect on it at a later point. Sometimes we get really stressed, we might not have that opportunity to discuss it, but you can maybe talk about it the following day and go, oh, Mummy got really anxious then and maybe didn't give you the space, or she was really rushing around, so we didn't talk about that. I'm really sorry about that. Can we talk about it now, or would you like to discuss it? I'm just wondering if Liz has something to say.
Yeah, no, it just made me think that often it's they may act out, which can be a typical way that children display their anxiety, particularly those that are neurodiverse. They may have a tantrum, they may be oppositional, and you would respond in a sort of disciplined way, or to sort of try and correct the behavior, because it's often a setting where you need to get it sorted out. Maybe they're running in the road, or there's something dangerous, and you respond to discipline, and it's only in retrospect that you can then realize actually maybe that happened because of they were anxious about X or Y. And not to berate yourself, but this is a constant learning process. They're learning, you're learning. just keep open and realize that often anxiety can come out in odd ways in kids, and often around opposition, acting out, or pushing back, or regressive type behavior. So, just keep coming back and trying to unpack things after you can calm down and they can calm down. It can be so, so valuable.
Absolutely. And in that instance, you'd be going in at the behaviours kind of part of this CBT model. So you might notice the behaviour, and then in retrospect you can think about, okay, what was the situation, what was the potential trigger for that, and you can almost sit down, and you don't have to use this model to go through specifically, but it can help guide, and you can unpick with your child or also independently. And we sometimes call it detective work as a parent. You know your child best, as I've already said, and sometimes it can be helpful to maybe keep a diary or keep a note of things that happen, so that you can maybe identify some of those triggers if it's a recurring thing, or ask other people involved in your child's care to notice particular times when their behaviour escalates, or they maybe withdraw, and then you can help identify what might be triggering that with your child, and with the other caregivers involved. And Liz was talking about a ship, and I think it's really important to try and involve everybody involved in your child's care in that ship. They're all taking your child forward, and so it's about trying to have that communication as adults, and model that good communication as well, and also using examples where you can kind of let your child in to know kind of what's going on for you. So absolutely, like Liz said, you've got to have those boundaries where you don't spill everything in front of your children about all the worries, but you can sometimes go, oh, I'm feeling quite worried going around the shops because there are lots of masks, but I know that it's safe because everyone's said that, or I'm noticing that I feel a little bit anxious, and I wonder if that's because there are lots of masks and I'm not used to that yet. So I'm going to try some breathing exercises to help calm me down, and actually I feel better now. So you can kind of narrate things as well. And then another exercise which I will take you on to, if Liz can, thank you, change slide, is getting your drawing pens out. Again, you can do this depending on the age of the child, but I found that, most children in kind of primary school are quite happy to draw their emotions. It doesn't come out as you expect it. This is just one example of what a child has drawn, but it can be in all sorts of ways, and it's about trying to get them to be as creative as possible.
It's a very detailed one. This one. His child is like going for gold.
Yeah, spent quite a long time on it.
Don't expect this one from your kids. It'll take time.
Yeah, good. Thanks for pointing that out. I liked it because it was so detailed.
It's awesome. Yeah,
I never normally get that. So
that's 12 sessions right there that kids put on there.
And it's using things like this, so drawing the anxiety, sometimes just sitting down with your child at the table with some pens and say, what's going on? And it will look nothing like this, but it could be that this is a suggestion that you draw a body, or you get them lying down and draw around their body. That can be quite fun, and it can also occupy some time in what can seem like what we were discussing at the beginning of this session, an endless summer holiday. So something to do.
And I wonder, Ellie, do you find if you showed a child this type of picture already done, it might be a conduit for just look at what this little child's done, and actually then see that how another child's described their feelings is and again another way to help them kind of label their own experiences as well.
Definitely, and I think it can be a really normalizing experience. Oh, other people experience this. I thought I was the only one, and that can be really reassuring. And hopefully for you as adults and parents to know that it's really common for us all to experience this. I felt my heart kind of beating faster coming to do this presentation, because I really care about doing it right and getting kind of the best information across to you. And because I know about it now, and I've identified that's one of my things that happens, I can use that to my advantage, because okay, that's because I care, and that's because this is important, and it's helping me do the best job I can. And sometimes just having those conversations and having that information can be really empowering. And sometimes it can be about just kind of drawing a bag and saying, okay, what's in your worry bag, and maybe how much space is that worry taking up? Is it really heavy, or is it quite a light worry that we don't need to worry, kind of focus too much on? So yeah, there are lots of different techniques and things that you can do, but essentially you're giving your child the opportunity to talk about their worries. That's essentially what we're doing. We're just giving you some more creative ideas of how to do that. Okay, can we move on to the next one, please, Liz? Thank you. So we've mentioned control already, but it is a big thing, and I've pinched this image that has been going around about coronavirus, what we can control and what we cannot control. And I think it's, again, a really important image to use and also to kind of convey to your children that, like Liz was saying, that there are people, very clever people high up, who are making decisions for our best interests. And those are things that we necessarily are outside of our control, but that's because they know best. And it's also identifying that things might happen that worry us or make us annoyed, and that's understandable. I think emotions are good signals to let us know how we're feeling and what's going on. So it's acknowledging them. It's not trying to push them away. It's going, okay, I feel cross that that person's come too close. And you can explore it, but also trying not to focus too much energy and time on it, because it won't necessarily take us anywhere. But maybe trying to focus and expend our energy on things that we can control. So we can control on kind of our access to news. So I've made a point of trying not to listen or look at the news much at all. I'll have kind of set times and I will limit it. The same with social media, which again with children I think is important anyway, no matter whether we're in a pandemic or not. We can control how much we do social distance and how much we follow the rules that will be in our school, whether it's a new school or not. We can follow those rules. If other people decide not to, then that's their responsibility. We might feel like we need to voice that with some people, and that's fine. And also kind of finding fun things to do and focusing on kind of my positive attitude, those sorts of things, and spending quality time with friends and family. Those are things that are in our control, and that's what we like to focus on. Absolutely, you can talk about things outside of our control and acknowledge them, but it's trying not to focus too much on them. Is there anything I've missed there? I'm sure there was something
No.
else that I was going to talk about.
No, I mean, I think that the control is a really, really important one. Again, for our kids that are more neurodiverse, it can often be something that we see go through the roof during anxiety-provoking situations. They become more controlling about their world. And also, you know, the fact that things have changed so much can itself, the loss of control can bring about anxiety in those kids particularly. So, you know, focusing with them on the things in their world that they do have control over, but also being aware that it is a tricky thing, because you cannot give them absolute, you know, routines. Things will change. But help them to have the skills to be resilient in those situations as much as you can. So it is a balance, but it is such an important issue, because I think kids, they have so much in their little world that they don't have control over. So working with them to help them realize what they do, what's in their remit, what's in their control. And doing things as a family, some of those things as a family is so, so important. And talking about it. Look, I'm going to turn off the news now because I think it's just all making us feel stressed out. Let's go have fun, and put it into words what you're actually doing. Demonstrate to them that you've chosen to cut off that because you believe it's not helping your family's health. So yeah, no, so important, this issue of control.
Yeah, and I think, like you're saying, what they can control, and also trying to have routine so that things do feel predictable. So children have some sense of security at home. So they know that they're going to have breakfast and this is what they do around breakfast time, and really focusing on those things and when they are playing, giving them that chance to really focus on that play, and giving them warnings before that play's ending, so that they have as much warning as possible in the areas of their life that they do have control about. And it can feel really small and insignificant to us, but like Liz says, there is so much that children don't have control over. Really trying to prioritize that at the points that you can, and going from being at home the whole time to then going outside of the home, that's going to feel like a big shift. So really focusing on the time when they are back at home, what they can have control over, and what is predictable again. And we know that schools have different rules and those things might change. So really talking about them, and whether it is writing them down and exploring those, can be really important. And another thing that I'm going to talk about next, if Liz can swap slides, that'd be great, thank you, is really about preparing them to go back to school. But this tool can be used for any worry. It's about really trying to break down what feels like a really big worry, and helping your child feel more confident in approaching that worry. So I've used an example of a worry that children might have, is going to school in case I catch COVID. And this is quite a big worry that might or might not be an issue for your child, but it's just a brief example. And what you do is you break it down into small steps that your child can do to prove that it will be okay. So what we know with anxiety is that we feel it in our bodies, and what we do as a reaction is we try and avoid whatever is causing that anxiety. So avoidance will actually feed anxiety, make it feel bigger and bigger and bigger. And so the remedy for that is to try and tackle it head on, and try and prove yourself that you can cope with that worry. And to do that, instead of going straight into school from being at home the whole time, you can do things to help your child feel more confident. So everyone will have done this differently. Some people will be out meeting people. Some people might still feel a little bit anxious. It depends on your family narrative. But also, if you've already started doing these things, then you'll be helping your child feel a bit more confident to go back to school. And like we were saying right at the beginning of this talk, it's going from being at home the whole time to then being at school, and going against all the things that we were told not to do right at the beginning of lockdown. So it's confusing for us all. But we almost need to prove to ourselves that it's safe now and it's okay. And so you can do things like going out for a walk to start with, and then you go out and actually you realize it's okay, and I haven't caught coronavirus and we're all okay. And then the way that you do this with your child is you sit down with them, you identify what the worry is, and then with them, very much following their lead, work out what steps they need to do. And so you start with the thing that causes the least anxiety. So sometimes you can rate it, what's your anxiety out of 10? So the going for a walk might be a 4 out of 10 initially. And so you keep going for a walk until that anxiety feels manageable. And then you might go to a play park where there are a few more people around. And it will be about you, maybe as a parent, for example, kind of challenging your worries as well. And you can talk about that. And you can think about what you have in your control. What can you do to control that? So you'll be washing your hands when you get in, or maybe using hand sanitizer, whatever works for you as a family. And then once you feel comfortable with that, it might be going to a friend's house. And again, we're saying all of this in line with whatever guidance is out at the time. We can't predict what that will be if you maybe watch this at a different time. But it's about doing different steps. And once your child feels comfortable doing that task or that thing several times and their anxiety drops, they feel comfortable to go to the next step, you then do that. And you want to kind of push them a little bit, so they do feel anxious and they feel a bit worried, but it feels manageable. We don't want to push them so far that actually their anxiety is too much and they can't do it. If that happens, that's okay, but the ideal is that you just push it a little bit and they feel comfortable and they can practice the breathing techniques and those sorts of things. And so it's kind of gradually, I suppose, socializing them back into school. So it's trying to make sure that they can go and see their friends, so they feel comfortable again meeting up with people, so that's not quite so daunting when they go back to school. And yeah, this could be for anything. Again, that's the importance of why you need to talk about your child, talk to your child about what their worry is and really break it down with them. Kind of sometimes feels a bit superficial trying to do it like this, because it's so important to get their lead and follow them, but it's breaking it down so it feels manageable, but you're challenging them each time. And that it's completely normal to feel worried about these things. And I felt strange going back to the shops after a while, and actually it's going to be strange going back into schools and those sorts of things. But actually, if you keep doing it, it will start feeling normal again, or the new normal. So that's essentially that kind of strategy, I suppose. Anything else you want to add to that, Liz?
No, just, I mean, it, like you said, that exercise with the hot cross bun where we try to elicit what is the underlying fear is so, so important, because if you then assume that it's going to catch COVID, your child might actually not even be worried about COVID. He could be worried about seeing a particular other child that he doesn't like. So that's, kids can, put 1 and 1 and get 5. So it's, as you don't project your adult expectations on them, because it actually might be totally off base. So it's so, so important, as you said, Ellie, just to really kind of be clear, well, what is your child nervous about, and what's the underlying thing. And also the real useful thing about that, getting to the root of the worry, is sometimes it can be a totally wrongly held belief that that you didn't realize they've got this sort of wrong end of the stick. So you can correct that as well once you get to the bottom of it. But this ladder exercise is used all the time across the world in therapeutic settings. So this is something which it's tried and tested and true. So we know it works.
Yeah. I've used this for a lot of children who are terrified about going to school. This was pre-COVID, and we literally took steps. We walked to the school. Sometimes we got halfway there. Sometimes we could get to the school gate, and we gradually built it up. To start with, we took for one boy I worked with, we went with his dog, and that made him feel safer. And we also, that's the joy of children, is we kind of thought about what the worry looked like. So you can sometimes draw the worry, and it was a monster. And then he used a red panther to help tackle the monster. So there are all these sorts of things that you can use to help your child feel like they're in control of the worry. So what can they have to make them feel safe? It might be an imaginary friend. It might be imagining that they can eat the worry up, or they can beat the bully worry. There are all sorts of things like that you can do. But essentially it is not acknowledging what that worry is and helping them gradually get closer and closer. And so it might be that it is practicing that commute to school. If it's a new school, that can be the most worrying thing for them. So practicing whether it's walking there, going on a scooter, going in the car, and just going to see the school, because actually then they'll have an image in their mind of what it looks like, and then they won't feel quite so daunted when they go there and there are lots of kids around. And also talking to them about what it will be like on their first day. Every school has slightly different ways of managing this. It might be staggered, there might be some people that they know, there might be in little bubbles. So really talking to your children so they know exactly what to expect, so that will help them feel more comfortable.
And drawing it out, doing little pictures, trying on school uniform, packing up your lunch bag. I mentioned in the handout that you guys are all going to receive is really, really important. I know we've all been sleeping a bit late because we haven't had anywhere to be in the morning. Try to get into your good sleep routine again. That's going to be so, so important for kids. Don't try and pull it off on the first day. Set yourself up for success by getting them into the sort of school day routine, talking about, oh, it's 3 o'clock, I'd be going to pick you up about now, starting to talk about the routine that they will have been used to in the past. and maybe even telling stories from when they were last at school before all this happened. Start sort of pulling all these ideas back into their mind about the normality of the school day.
Absolutely. And it might be, particularly if you've got maybe children with autism, for example, getting pictures up of the teacher, if you've got any pictures of the room, so there's that, the setup there, working with teachers if you can to kind of help reintroduce people and have that kind of graded exposure is what we call it. But also, yeah, practicing packing their bag the night before, so that there isn't that kind of as much chaos in the morning. There's always chaos. I think I don't know anyone who doesn't have that chaos in the morning. But maybe putting the school uniform out as a kind of preparation. And it is so important to try and get to bed at the same time they would on a school night, to get your rhythm back, so it's not quite so painful. And yeah, having breakfast, and maybe kind of having similar meals to what they might be having at school, or if it's packed lunches, practice that, and having discussions about what they might be eating if it's if it's the first time they're going to school, those sorts of things. And then the final slide of mine very much kind of goes through this. So things that you can do as parents and that your children can do to try and keep that control. So it's practicing the relaxation exercises when you are relaxed as well as when you are anxious. We might practice all sorts of things. So if we try to do a driving test without practicing that, it's not going to go very well. So exactly the same thing goes for these relaxation exercises. It's trying to embed it in your everyday routine. We know the best way to do that is try and add it on to something we already do. I'm guessing most of us will brush our teeth twice a day because that's just the routine, that's the habit we've built up. So it's about trying to embed some of these relaxation exercises into our routine, so it's part of everyday life, so that then it will come more automatically when we are worried. It does take practice, and you as parents will have to remind your children quite a few times to do it. You might want your friends or family to remind you as well if it's new to you, because it's a new habit, it takes practice. So that's kind of the number one tip there. And then worry-free time is really important. So this can be called quality family time, where you really try, especially once everyone's back to school, to make the most of that family time that we've maybe got so used to recently. But it's also about trying to monitor how much we talk about our worries. So we've spent most of this session saying it's really important to discuss them, but equally I want to kind of point out that you don't want to talk about them all the time, because then you're almost putting more kind of fuel on the fire sometimes. We sometimes talk about kind of feeding the worries as if they're a tomato plant. So if you constantly talk about your child's worries and they keep asking you for reassurance, if you're constantly finding that you're discussing them and talking about them, that's when you might think, okay, I'm maybe kind of reinforcing the worry and giving it too much time. So like with everything, there's a balance. You want to have that open kind of conversation and talk about things and model kind of good emotion regulation, if we kind of use some of the psychology terms. But equally, you don't want to kind of keep going over and over and over, because then the worry will become bigger and bigger and bigger. And your child will think, okay, well, if we're talking about it, it must be something to really worry about. So if that is the case for your family, again, everyone's slightly different, so you've got to kind of pick and choose what works for you, or kind of test it out. What can be really helpful is having what we call worry time. So you have a specific time, maybe in the afternoon, or maybe when you're driving back from school or walking back from school, where you might kind of ask, how's your day been? Or if there's anything come up that you want to talk about, and really expand that. Lots of kids, when they're asked, how was your day, will say fine, and just kind of shut it down. So you might need to be a bit more inventive about asking about it, or discuss with them at another time that might be a good time to discuss any concerns that have come up. But often it's really important to try and have that really focused time. So be careful if you're walking back from school and there are lots of things going on, that might not be as effective as if you sit down with them. And that can be the time where you discuss them and think about them, and you might do the kind of hot cross bun method and really explore it. But then it's about trying to kind of put a lid on it. So sometimes children might want to imagine having a worry box, and throughout the day they might put those worries in the box and they put the lid on, and then it will be opened later on with mum and dad or one parent or the other, and you really spend the time thinking about it, but the rest of the time is about focusing on other things and trying to put that worry to one side so you can focus on what you're doing and enjoying that time, or focusing on schoolwork, that sort of thing. And then we've touched on this already, again, is routine. So trying to make things as predictable as possible, but also trying to get your routine to fit with what it's going to be like when they go back to school. Things always slide during summer holidays, as they should. We all need time off, but maybe trying to gently kind of bring those routines in sooner rather than later, just to gradually do it so it's not quite such a culture shock for all of us. And yeah, I think sleep is one of the most important things to try and do that, so that we can try and be up as alert as possible to start the day, whether we need caffeine or not. That's up to us as parents to make that decision. So those are kind of the top tips, and I think now we are coming to questions. So if there's anything that didn't make sense, or you want further clarification, or if there are specific examples that you would like us to explore, please ask away, either on the chat or by unmuting your microphones, and we'll be happy to answer what we can.
So I thought, actually, Ellie, I could talk a little bit, that we've got a question from one of our parents that have a neurodiverse child. So maybe I'll kind of do a bit of a kind of summary a little bit to think about anxiety in those groups. So when we think about children who are on the spectrum, children with ASD, we do know that anxiety problems in general can be more common. We think that's in part due to sort of maybe they have difficulty understanding and navigating the world and getting those verbal and nonverbal cues, and working around emotional labeling can be really valuable with children on the spectrum through the use of social kind of cues like pictures, talking about, maybe you're watching a program, talking about photographs, pictures, Makaton symbols, using these to help the child understand a little bit about their internal sense, their state. Use your own parental intuitive sense. If you think that they may be experiencing anxiety, then go ahead and maybe begin to, maybe you're feeling worried about this thing that happened, start talking about it. Their bodies feeling different when they're worried, things like that. That can help them to begin to understand maybe what's going on inside for them. And that itself can bring down anxiety. It can be difficult for kids on the spectrum to begin to imagine what a scenario is going to be like. So where a child that is neurotypical might be, casting their mind back to last year when they were at school before lockdown, a child on the spectrum might not be able to make those inferences to guess that it's going to probably be this way or that way. So they might need you to more deliberately talk about it. Remember, you're in year 5, your classroom will be upstairs and your teacher will be Mrs. Smith. And here's her picture. And get copies of the timetable, start to help kind of describe what their day might be like. And they can begin to maybe give you a little bit of clues of whether or not they're feeling concerned. Children on the spectrum may have issues around anxiety due to sensory processing issues. And you yourself as their parent may kind of anticipate this already. Maybe they have already had issues with the playground, the sound, other things like that. So, this is a little bit of being, telepathic and guessing, and being a bit of a future teller as well, having a bit of a kind of sense of what might be coming up ahead for them, and being very clear to communicate with the teacher that you have been spending a bit of time talking with your child about what this going back might be like, but you still are concerned that they may display particular behaviors due to anxiety, and you would appreciate the feedback, how are they doing, things like that. So just really open the communications proactively with the school. Our kids that have ADHD, they may be worried about getting it wrong, not understanding the rules, because often their anxiety can come around getting in trouble and doing things wrong. So talking to them a little bit about the fact that they'll be in bubbles, that it will be impossible to have perfect social, social distancing is good, but it probably won't be perfect. And that's why the school have everyone in bubbles or pods, or, talk to them a little bit about how it's okay to make mistakes. We're all doing everything we can to keep safe. But even children and adults who don't have ADHD get too close to each other sometimes. Just ease their fears as much as possible, that it is okay to make mistakes, that just try your best like you always do, and we're here for you. And sometimes children with ADHD can become flooded with their emotions. So the work that Ellie talked about at the beginning around breathing and helping them to really ground and center themselves in their five senses, using the hand just to count it down, can be really, really helpful to come out of that sort of emotional hurricane that they can, the anxiety hurricane that they can feel they're in the middle of sometimes. How can those kids maybe display anxiety that's different than neurotypical kids? Well, I mean, there is a lot of similarity and a lot of bodily sensations, particularly in our littler kids. But also, as we see in neurotypical, challenging behaviors, acting out, tantrums, that can be very common in kids that have neurodiversity. You may see repetition, as we mentioned, controlling behaviors a bit more. So what we talked about, routines and stuff, really would come in here. Becoming a bit more withdrawn or retreating can be typical of a child who's feeling anxious about something. So that would be a clue that you need to spend a bit more time using what we talked about today. But one of the biggest things that we would use with our kids who are neurodiverse are just more methods of communication, more types of communication, visual, video, Makaton symbols, really draw on teams and what resources are out there to just really help find different ways to build the bridge to that child, and just to begin to help understand their sort of internal world a bit more. Communicating as well with the school. So just as I said, be proactive, and just if you have concerns that your child is going to have issues in a particular area, just flag it up now and see whether or not the school has any great ideas. And we mentioned again, just it's a lot of the same stuff. These still are kids. They still look to us to help regulate. So keeping calm and modeling it, and also being mindful of the environment for all kids. Is your house just full of loud TV going all the time, screens going all the time? Can you maybe think that you can pull the dimmer switch down just in these 2 weeks running up to school starting, to make a more calm environment at home? Because that's going to really help to regulate them and you. And as Ellie's mentioned, just avoid being hyper vigilant of your child, because they can pick up on that, and you kind of feed off each other. Making that space to talk about worries can be really helpful. If you sense that you and your children or child are getting into that, are you worried now? Are you worried now? Now are you worried? Let's talk about your worries. Just be really aware that can set them off. And, I suppose, as much as we said, we're talking about the normal gamut of human emotions, that this is a stressful situation, that, we've all been in a massive adjustment reaction, the whole world, on what's happened. That there will be some people that do need extra help. If you're trying these things and they're not working, don't berate yourself. Reach out to one of us, and we can try and point you in the right direction if you think you need a bit more help from one of the professionals at Star Jumps or Ellie. So, do reach out if you try these things and they're not helping out. So I've had a question about a worry box, which Ellie mentioned, and it's been a popular thing. You see it on things like Super Nanny. It's a great sort of way to give the kids actually a physical thing that their worries are being held within a worry jar or box. So at the end of the day, you would sit down, and having the child had a little pad of paper where they can sort of run up and put their worries in this box. They know that before whatever bed, brushing teeth, you're going to sit down and you're going to spend a little one-on-one time with that child to unpack those worries. And the question is asking about whether it would be helpful for older children, and I would definitely say yes. And often I find with older children, especially during anxiety-provoking times, there can be, as with our little ones, regression, where we'll see toileting accidents and tantrums. Our older ones, although they might not say it, and they might stay outwardly at a sort of their same developmental stage, they may need a little bit of babying and a little bit of extra something. So doing something that's very concrete, like a worry jar, can be very helpful. And it's something that as over time, you have that habit where you sit down with them and unpack the worry. What they'll learn is that although I was very worried about something at 9 a.m., when I came to sit down and talk about it at 7:30, it actually had lost its, like the wind had got out of the sails of that worry. And so I kind of didn't feel worried. And they'll realize over time of that practice of doing the worry jar that just getting it out on paper, it often is just enough for it to quell and not be a concern. And then you can sort of move towards actually just that one-to-one time where you're talking and connecting. And if anything is still sitting at the back of the mind, it's still got a bit of life left in it, you can talk it out between the two of you. So yeah, definitely that's something that I would recommend for kids of all ages. Sometimes grown-ups probably need a worry jar as well. I've seen them on sale for adults as well. So any other questions just from the audience that you guys want us to raise? School refusal, okay, in a young autistic child. Ellie, did you want to field the next one?
Yes, so I've just had a couple of questions there. How do you deal with
Okay.
school refusal? So the strategy that I was talking about with the ladder, I have used with several young autistic children who were refusing to go to school. The key thing with school refusal is to work out what it is that is causing it. So we're very good at kind of banding around the term school refusal, but I think it's really important to work out what it is that's making that child so anxious that they don't want to go. And like I said at the beginning, how we normally deal with anxiety is we try and avoid it. So we have our fight, flight, freeze response. And sometimes freezing is the most effective way, and kind of retreating back to our safe house where it feels comfortable, we understand it, it makes sense, can be the most important thing to do. So I think with that, it's about sitting down with your child, exploring what it is, and trying to work out what would make the child feel safer, who do you need to involve in that conversation, which key professionals would it be helpful to have? Is it about going into school, having that meeting, or is it possible to have someone come to the house if that's needed? In these situations, it might be helpful to have a professional as a bit of an advocate as well. Again, I don't know what your situation is and how much you've done already, but like Liz was saying, it's so important to try and communicate with members of staff at school. And what I've also done quite successfully is sit down with children and work out what is the anxiety, what's the issue, but also what would make them feel safer. And almost creating a bit of a handbook to your child so that they can have ownership over it and maybe hand it to a teacher, or know that the teacher will know what they will look like if they're anxious or worried, what they can do. So sometimes it might be about having a green, orange and red card. So orange is when they're feeling a little bit worried, and actually it might be helpful to use some strategies like breathing or the muscle relaxation, or there might be a red card when it's all too much, they need to remove themselves from the situation. But also the green card, actually no, I'm okay, and that's really good. So again, it's about working out those those sorts of strategies that work for your child. And that communication is so important, and sometimes a communication book so you can kind of help facilitate that's really, really helpful. Is there anything else you'd add to that, Liz?
No, probably just because going back to school is so, I mean, you're working with a deadline, right? It's tricky. So I would say, work on the ladder, work on some of the things that Ellie's mentioned, and then don't wait too long to flag it to the school. And if necessary, don't, like, let's say maybe a week before, if this is still a concern, make sure they know about it, make sure the SENCO knows about it. They have tools that they have, available, they can, call upon to help see if they can make this transition easier and accommodate your child's needs. But it can be very difficult if you tell them about it the sort of morning before or the night before. So try out the things we're saying, try and work on a hierarchy, try and work on some of the things I've mentioned. But yeah, don't sort of leave it too late to flag it to the school.
Yeah, I've just had a question in as well, talking about children worrying about parents not staying at the school or the preschool, which I think is a really important point. And again, I'll come back to the ladder. So it might be about practicing going to school and maybe walking around and having that time where you as parents are with your children at the school. But also, if they're really worried about it, try and contact the staff and see if for the first day or maybe more, if you can stay around, or agree that you will stay in the car outside of school. So if they are worried, they can come out, but having that agreement in place to begin with. So it's very much about working with the school and checking what's possible. And again, in these times it might be a little bit trickier to navigate, which is frustrating for everybody, I'll acknowledge that, but thinking about what it is you can do. So if you can go to the school now and just drive around so they're familiar with it and walk around it, and if possible to go on the grounds and stay there, and I don't know what the setup is, maybe play some football in the playground if you're allowed, so that they kind of associate you being at school and it feeling safe, but also kind of saying, well, to start with, for the first few days I can just stay there for half an hour if that makes you feel better, and if there are any issues I know that staff will come and get me. And then once they feel more comfortable, as I'm sure they will, you can say, okay, if you're okay tomorrow, I might just stay for half an hour or 10 minutes and gradually reduce it down, and then check, okay, well, you've been fine, I don't think I'll stay, but school can always call me if there's an issue. So it's creating that narrative, but also showing that they're going to be fine, they've got those skills.
Yeah. Definitely, attachment issues is just a normal anxiety-provoking situation for little ones. And as I mentioned, this situation has caused many kids to kind of regress. They have been with us all the time. I mean, initially, I couldn't go upstairs without my 5-year-old wanting to follow me everywhere I went in the house. So, there's a certain amount that's to be expected, but the importance of these times apart, just generally, even outside of this pandemic, particularly kids starting school and preschool, is that they see that we return, right? So they have the time away, they're upset, then they get over it. We as parents might still be, weeping in the car because we are little babies growing up, but then, we can get over it. And then there's the reunion, and they realize that actually they're okay, that you're okay, that you exist outside of home, and that you continue existing, and they're a separate entity. They're enjoying school and learning. And then there's the reunion. So that separation and return is an important stage of development for children. And it's normal for the little ones to find that hard. That transition is hard for them. And it's hard for us as well, because it's a letting go, a phase of parenting that, although we joke about how nice it is to sort of offload them at school, it is also, there's tear-jerking moments there as well. I've got another question that just talks about like using these techniques. And if we sit down and start using these techniques and say, that the kids haven't maybe said they're worried yet, do we kind of end up seeding worry in their head? And yeah, that is an interesting question. It is, there is potential that, let's do some deep breaths because you're starting school. Okay. And actually, well, hang on, I thought school was fun. Yeah, there is a potential that we could end up, kind of passing on our worries. Worries can be contagious, especially, from parent to child. But I would say if your child is not seeming like they're phased about going back to school, then maybe couch that this is a really good thing, that I was learning the other day on a talk, that when, we're worried and stressed out, our thinking brain goes to sleep, and we need to wake it up again by taking some deep breaths, like this, and I imagine I'm drawing a square in the air with my breathing. Can you do it too? And really couch it as more like, this is a really good thing to do when we get red from angry, when our angry volcano is exploding, or when our worry monster is getting too strong, that we can blow him away. So just in terms of just a really good psychological technique to get under their belt going forward, really that would be the way I would couch it if your child seems, non-fussed about going back to school. Because it's something I think that, we'll all use at some time or another, job interviews, interviews for university, etc. So good skills for our kiddos to have generally under their belt.
Absolutely.
Any other questions from you guys?
Hello.
Hey, Joe.
A really helpful talk, and particularly the techniques. It seemed to me that lots of the techniques, I was thinking, yeah, I can try that out with my 9-year-old. But I was thinking, how am I going to get on with my 3.5-year-old, trying to get her? And yet, actually, the 3.5-year-old is super anxious at the moment, and dealing with anxiety in younger kids, I guess, is much more tricky. Do you have any advice about a 3.5-year-old who's sort of clearly anxious, having more tantrums, she's being more controlling, all of those things you sort of mentioned, but what box of tricks can we employ with a 3.5-year-old?
Well, actually, I don't know, you guys get Sesame Street in the UK, but you've got access to it through social media. They have done really interesting few little videos. And one of the videos they did do was one of the little puppets, Rosita, doing belly breathing, which I would say was appropriate for her age, definitely. So, and also they've also got an app where the child breathes away the worries, and actually see them like little worries floating around the little monster, the Sesame Street monster. So using those kind of things would definitely be useful. Another thing for kids with anxiety is, physical movement to sort of burn off that adrenaline, jumping, moving, pushing, pulling, stretching, just real sensory rooting in their bodies type thing. And for adults as well, I don't know how many of you guys know that when you're stressed and you're like, I cannot do some deep breaths, doing some squats works really well as well. Using your big quad muscles to burn off that adrenaline can work really good as well. So that's kind of when looking at a preschool child, that's the kind of thing I would do. The other thing that would be helpful is the use of play. I mean, play generally for kids is great, but particularly for that age range where they're just kind of pre-verbal, verbal, they're in terms of like emotional language. Yes, she's talking away to you, but can she put into words when she's in an emotionally heightened state? Maybe not. That's why you're seeing the tantrums. So the use of play to kind of enact what might be going on can be really useful for that age range, and would allow you to perhaps access what are the underlying fears. In little ones her age, it can be just a very amorphous feeling of separation. She might not have a clear sense of danger, which, with my 5-year-old, I've chosen to shield her from a large amount of the information of what's going on. It's more difficult when you go to the store, clearly. But giving her a sense of how worried you guys are as parents, as in I'm hoping that you would sort of project to her that you feel everything's under control, and that we're doing this to make sure in case you sneeze that you don't pass any bad bugs. I like to talk about bad bugs and good bugs because I'm nutritionally minded. I don't like to label all the bugs as bad because it's not fair on them. And talking to them about that mommy and daddy are not worried about the coronavirus, which is what she's called it, and that we're just listening to what the doctors and that are telling the prime minister what we should do, and we're following the instructions, but we're not worried, and our family are very healthy. And really, I suppose, be guided by what comes out during the play. And children often are, they just jump around. So you might just get snatches of what maybe she's concerned about. The primary thing is probably just being close to you, attachment. And if there's any transitions, I don't know for you guys, is she going to a preschool? Is there a return to school for her as well?
Yeah, well, she's going to start a new nursery, I suppose, which is then into pre-prep, and so I'm going to have to try and see if I can do some transition with her.
Yeah.
Because previously she was fine, but she doesn't know anybody there. It's all new.
A double whammy, yeah.
I think, and she's been with me the whole time, and even my parents have gone away for a couple of weeks, and now she's completely freaking out, and I think it's because they've gone. And she's seen, it's just that change. She's definitely had a regression just by them not being around all of a sudden. And I think just from being with us the whole time, I think I'll have to try and do some sort of transition and see if I'll do that.
Yeah, I would. Yeah, definitely like a prolonged settling in, and before that starts talking about what it's going to be like, and that you might be a bit worried, but I know you're going to be okay, because do you remember what it was like when you went to your other preschool? And at the beginning you were worried, but then you found so much fun, and just talking it out as much as you can. She'd probably sort of entertain it and then maybe walk off after a little while. They kind of will dip in and out of how much information they want and can take. But I expect, but I would hope that the preschools are going to be particularly accommodating in terms of settling in periods, particularly at the moment, because the kids have had us so much. A lot of their age range would have gone to a childminder maybe as well before preschool. So a lot of their ages are going to have a big jump to start preschool from having 6 months with mom and dad at home. So that would be my thoughts. Lots of play, physical activity, and I'll make sure to include the belly breathing stuff and the app, the Sesame Street stuff. So I think that'd be really helpful as well.
Thanks, Liz. Thank you.
No problem. Anyone else have any thoughts? Or
there's a last question on how to explore anxiety and emotions around school with speech and language delay and autism in a 4-year-old. I feel like we might be at the end of time to explore that properly, but one thing that we'll try, and what I'd like to add in the handout, is there's a really good book called The Kid's Guide to Staying Awesome and in Control, and that has some of the strategies that Liz, you were talking about, kind of more physical things to do, and when children are feeling anxious. And also you can kind of develop those kind of traffic light systems, so you can sit down and work out with the child in their own language, and using the strategies that they find helpful, whether it's pictures or whatever, or drawing it out, so that they can maybe identify a face that they might look like when they're feeling worried, and actually they can use that to show someone. Instead of using language, they can use those pictures to convey how they feel. And also you can then match it with, if I feel like this, I use this strategy. So there are kind of self-hugging ones, they're maybe throwing a ball around. Something that I really like is using whoosh breathing, which is more active. So you kind of put your arms in when you breathe out, and then when you breathe in, and then when you breathe out, you kind of fold forward and kind of go whoosh, and it can be very good fun with little kids, but also older people. So it's much more physical, you get that movement, but you're also including that breathing as well. So we'll put that link to the book in there as well. And if in doubt and you need more support, I know there are speech and language therapists that you work with, Liz, that might be appropriate. I don't know if you have any last words of wisdom before we kind of wrap this up.
No, just thank you so much for joining us this evening. I think it speaks volumes about how invested you are in making this a successful transition, and you know, entrust your parental instincts. I like to say to parents, you're the world expert in your kids. You know, we've dipped in, but you know, we still haven't taken that title. That belongs to you. And trust your instincts. If you think your child might be experiencing anxiety, if you've checked in and you've had a thought about your own history and your own story, and you've calmed yourself, you've done your breathing, then be confident that you now have some extra skills and tools that you can call upon to try and help your little ones navigate this transition. And we're here available. These are email addresses, and we'll get a handout out to you that's got a few extra things. I've snuck a few nutrition tips in there because I can't help myself, and a recommendation just to make sure your little ones are all taking vitamin D at the government recommended level by minimum, and think a bit about the steps we've talked about today. And we've included a blank ladder, and maybe we can put the grid as well with all the different muscle movements as well. That might be good for everybody.
Absolutely.
So thank you so much for joining us, and we are available via the email addresses if you want to know or reach out for more help. Okay, all the best, everyone.
Thank you very much.
Okay.
Thank you.
Bye.
Bye-bye.
Cheers. Bye.